Hello, this is Stephanie Costa. I'm one of the EMS fellows for the current 2023-2024 EMS fellow year at Cooper University Hospital, and I wanted to take some time to review trauma care at the BLS level for everybody. Why is trauma care in the pre-hospital setting important? Good trauma care can help decrease morbidity and mortality. Trauma patients can be more injured than initial inspection shows. Therefore, an initial evaluation and repeat evaluations are going to be very helpful for the patient. And we also have opportunities to intervene early and save lives in trauma. So overall, the view of trauma care is based off of a primary survey, a secondary survey, and then getting the patient to definitive care. We'll take some time to go through all three of these in the upcoming slides. So initially, you are going to do a primary survey on a patient. Many courses teach A, B, C, D, E, and we will also go over a different mnemonic in the upcoming slides. But A, B, C, D, E stands for airway, breathing, circulation, disability, and exposure. So when you're assessing an airway, you need to check for swelling, foreign bodies, bodily fluids such as blood or vomit, voice changes, a hoarse voice, any sort of abnormalities on your assessment. Look for trauma to the face or neck, and an easy way to assess a patient's airway is to ask them to speak to you. Ask what their name is, ask where they're having pain. Then also see what interventions you need to perform when assessing an airway. Do you need to suction the airway? Do you need to reposition the airway? Do you need a cervical collar for concern of a neck injury? Do you need to place an airway adjunct device to help with their airway? These are all thoughts when assessing a patient's airway. Now let's also take a look at their breathing. You want to see if the patient is adequately moving air into their lungs. If yes, that's wonderful. We can move on to the next assessment. But if not, why not? You have to ask yourself, why are they not breathing appropriately? So you can assess for trauma, for any mental status changes, for body positioning. If they're laying on their belly, they're probably not going to be able to get air in and out very easily. And you also want to listen to your patient's lungs. And then you want to ask yourself if you need to breathe for them. Next, you want to check their circulation. So you want to listen to their heart, check their pulses, check their capillary refill, and see if they're pale or cyanotic, anything else there. You want to see if they're bleeding anywhere. Do you see any large open wounds? Do you see any large deformities of long bones where blood could be hiding? Is there an unstable fracture leading to internal bleeding? And beware of broken pelvises and femurs, because when those are broken, they can lead to a lot of vascular damage, but also the blood may be building up inside the tissues and may not be outwardly noticeable. And then you want to assess for disability. So what is your patient like? Are they awake and interactive, or are they somnolent and minimally responsive? You can calculate their GCS. You can see if they can move and feel all of their extremities. Are they able to speak clearly to you? Are they able to comprehend what you're telling them? Can they follow directions? Things like this are all very important when assessing somebody's mental status and if they have any disabilities. You can also repeat this frequently just to catch any sort of decline in their status. And lastly, in our ABCDE mnemonic, the last is E, which is exposure. So you do have to check your patients for any injuries so that you can intervene appropriately. This maintains, while maintaining patient modesty, you perform a good exam of the patient. You're not going to do any sensitive exams, but you do need to see if they have any large extremity deformities, any bleeding, things like that. And another note is that trauma patients are very sensitive to the environment, so make sure that the patient is in a safe location with appropriate body positioning and precautions as needed. Make sure that the patient is not left out in the elements. And a good thing to note is that being cold will worsen the body's ability to clot if there is bleeding. So the patient does need to be kept warm at all times. So that just needs to be factored into when you're examining the patient and overall taking care of your patients. So there is the ABCDE mnemonic, but there's a different mnemonic that we also would like to go through for the primary survey, because as studies are starting to show, we need to optimize circulation and stop blood loss very on for patient survival. So we can take a look at the MARCH acronym from the Tactical Combat Casualty Care Guidelines. So M is for massive hemorrhage. It's a very survivable cause of death. So if there's any large areas of bleeding and hemorrhage, they need to be stopped very quickly. Airway is also a survivable cause of death. So consider an oral and nasal airway adjuncts if appropriate, but also if they need further intervention, please call for higher levels of care. The medics may need to arrive on scene to help with a definitive airway. Respirations are also very important, as we don't want our patients to become hypoxic and lead to a respiratory arrest. So traumas can cause many different things, including pneumothoraces. Attention pneumothorax, which is when now the pneumothorax is starting to put pressure on the internal structures, can be treated in the pre-hospital setting by those acting within their scope of practice and protocols. So if there are medics on the scene and they, within their scope of practice, are able to needle decompress that chest, that may help with the patient's respirations. Also, you may need to bag valve mask ventilate the patient if they are not really breathing too well on their own, but it's important to note to always act within your scope of practice and within your protocols. C is for circulation. So that also goes hand in hand with massive hemorrhage. We want to stop the bleeding because that's definitely going to be more helpful than infusing a lot of crystalloid fluids, which is just going to dilute your clotting factors. So we definitely want to support the patient's circulation and try to keep the blood internally so that their body can keep on carrying oxygen and nutrients to their cell tissues. And then H is for head injury, but also hypothermia. So in head injuries, we want to maintain the patient as well as we can and avoid hypotension and hypoxia because those all worsen outcomes in patients with head injuries. And then also, as we discussed earlier, hypothermia is preventable, but also untreated hypothermia is also going to lead to more blood clotting issues. So make sure that your patients are warm and well cared for during their transport. And if you find any deficits in the primary survey, you need to stop and fix it right then and there. And then you start at the top again and reevaluate the patient and call for help as appropriate. So let's move on to the secondary survey. This is when you have that time to really take a good history and really good exam of your patient. You can use a sample mnemonic or any other mnemonic that helps you to take a full history. So with the sample mnemonic, you want to ask patient about signs, symptoms, allergies, medications, past medical history and surgical history, last meal intake, and events leading up to this incident. And then while you're doing your secondary survey, you can recheck the patient's pupillary response. You can get a better look at a lot of their injuries. You can recheck their vital signs and recheck the earlier interventions that you had to perform. And then you need to get the patient to definitive care. Now let's look specifically at the Cooper protocols. This is not an exhaustive review, but just some big points. So please take the time to review the protocols and please reach out with any questions. So first let's cover burns, electrocution, and lightning. So for all these patients, you need a very good airway assessment. These airways are dangerous and can decline very rapidly. Somebody may be talking to you, but then may have rapid edema in their airway leading to a respiratory arrest. You also have to ensure your own safety in these situations. For burns, you need to stop the burning process and thermal injuries, so you can take off clothing, but just make sure that you're not removing underlying skin. You can cover the burns with clean, dry, sterile dressings for transport and patient comfort. Also remember that a lot of these have trauma associated with them, so if they need spinal motion precautions, please take those, but also note that electrical burns sometimes have very high energy that go through them that can also cause a lot of damage to bones. Provide ventilatory support as needed. Consider burn center needs, refer to your protocols if you can go there first or if you need to go to a trauma center first. And then also always consider hazmat and decontamination of burns, just to minimize the patient's exposure, but also your own too. For drownings and submersions, be cautious to see spine injuries, especially when we don't know how the patient ended up in the water. We want to make sure that we're not missing a spinal cord injury. Monitor your ABCs and keep the patient warm. For eye injuries, see if the patient can take out their own contacts. You can flush the eyes with copious amounts of water or normal saline for at least 20 minutes in the setting of chemical irritants. And do not remove impaled objects in the eye. For dental injuries, a big one is dental avulsions, which is where somebody has lost their tooth. You can put that tooth in the container with a saline-soaked dressing, milk, or cell culture medium. Do not place that tooth in tap water. Also, do not try to clean the tooth off or hold the tooth by the root. That will affect the viability of the tooth and its ability to be reimplanted. Moving on to musculoskeletal injuries, you always want to take a good history and physical exam. Stabilize any injuries, control the bleeding, treat for shock, and if there is a part of the body that was amputated, please also bring it to the hospital. When you are splinting your patients, just make sure that you are padding that well, just to prevent any further skin breakdown or discomfort. For thoracic and abdominal injuries, if there is an impaled object, stabilize and support that object to prevent it from moving as much as possible. Cover any penetrating injuries with an occlusive dressing. So like a gunshot wound to the chest, you can put a chest seal over that. For eviscerations, you want to cover the organs with saline-soaked sterile dressing and then an occlusive dressing. Do not try to force any of the organs back into the abdomen because there is a high risk of perforating whichever part is outside of the abdomen. For traumatic brain injuries, you want to manage the ABCs, and then you also want to perform very frequent reassessments, about every 5 minutes. And you can reassess their GCS, pupillary response, any of their motor, sensation, pulses, any sort of assessment very frequently to be able to tell if they're declining, stable, or getting better. And if they're not under spinal motion precautions, you can also elevate the head of the stretcher to 30 degrees. Of note, please always follow your protocols and contact medical command for any questions. Nothing in this lecture supersedes your own protocols and laws. And please feel free to reach out with any questions. And here are my references.